the journal Nutrients in 2022, just last year, entitled an article, Red Blood Cell DHA, and I'll define that in just a minute, is inversely associated with risk of Alzheimer's disease and all-cause dementia. So this is pretty exciting because you're looking at a nutrient. DHA is one of the omega-3 fatty acids. A lot of times you see them together. This is a supplement we carry. It's EPA and DHA combined. That is typically how you see it. But this specifically was looking at the amount of DHA in the red blood cells and how that was affecting Alzheimer's risk. So they looked at population that did not have dementia or Alzheimer's. They were 65 years and above. And a lot of times you'll hear about quintiles, which is if you take the reference range in a lab test and you divide it in 5 equal parts. They'll talk about the upper quintile and the lower quintile. So it's simply taking that reference range and dividing it into equal fifths. And what they found is that people who on average fell in that upper quintile of the amount of DHA in their red blood cells were at about half the risk of developing Alzheimer's and all-cause dementia as well as compared to those in the lower quintile. So they estimated the savings was about close to 5 years of life with no dementia, no Alzheimer's, and so quite significant with this supplement that we know to be very helpful for heart health as well as brain health. We know that babies in utero developing do better when their mom has enough DHA in her bloodstream. So this is a birth through elderly supplement or substance, I should say, that's very, very healthful. So where do you find DHA? It's in cold water fish, fatty fish, like salmon that we all know. Then the smaller fish, mackerel, sardines, and herring. I wish I liked those. If you like them, tell me how to prepare them. And then also tuna, but I would really caution you away from tuna because tuna tends to be very high in mercury, and mercury is a neurotoxin, so it's the exact opposite thing we want for our brain and nervous system. And then also in the vegan vegetarian realm, there's seaweed, also flax seeds, chia seeds, walnuts, so they tend to be high as well. But there are some great tests where you can just see what your DHA levels are in your blood and get an idea of how much to take. So the recommended dose of DHA, again, they do tend to come together in a supplement, the EPA and the DHA, but the recommendation is 1.2 to 1.6 grams per day. So that's 1,000 milligrams, 1,200 milligrams if it's 1.2. So the supplement I just showed you, that would be 3 of those, would get you in that range. So definitely something you want to consider if you have the wherewithal to get a specific blood test. Very good idea to raise your DHA levels and have them in that nice robust end of the quintiles, right at the top of the reference range, to protect you in a very, very meaningful way, protect your brain in a very meaningful way to prevent Alzheimer's and any cause of dementia. So I hope you found that helpful. If you are starting to feel like you're having brain fog, memory issues, we are highly trained here at Root Cause in Dr. Bredeson's method. He wrote the book, The End of Alzheimer's, so there's more than just DHA, but that's a great place to start. But if you feel like you're struggling a bit with this, the beauty of that research found that within the first decade of being diagnosed, so not just, gee, I wonder, I'm at a little bit of a loss for words, I'm having some memory issues, but an official diagnosis, you have a decade. That's the window in which the research showed it was reversible. So pretty exciting. Doesn't mean you're stuck with it. So reach out. I'll see you soon. I hope you found this video helpful. If you want more on this topic and others, click here.